Before we even talk about risks, I want you to picture a woman sitting across from me in the clinic. She is 36 years old, maybe 38, perhaps even 40. She has built a career, found stability in her relationship, and finally feels ready to have a child. Yet the first thing she hears from friends, family members, or the internet is this: be careful. This is a high-risk pregnancy. You can imagine how frightening that sounds. Over the years, I have had many women ask me the same question. Doctor, am I already too old? If I'm over 35, does that automatically mean something will go wrong? Should I be worried before I've even become pregnant? These are understandable concerns, and they deserve calm, honest answers rather than fear. The truth is that becoming pregnant after the age of 35 does come with certain increased risks. Medical studies support this, and it is well documented in obstetrics, but that is only part of the story. The other part, which often gets lost in the conversation, is that millions of women over 35 have healthy pregnancies and healthy babies. What matters is understanding what these risks actually mean, how they apply to you as an individual, and what practical steps can help support a healthy pregnancy journey. In my years of clinical practice, this is something I discuss almost every day. Women are becoming mothers later in life than previous generations. In the 1970s, the average woman in Germany had her first child at around 25 years of age. By 2021, that average had risen to approximately 31 years. That means women are becoming mothers roughly 6 years later than they once did. Today, about 1 in 3 pregnant women is over the age of 35. Because of this, pregnancy after 35 is no longer unusual. It is not something that causes surprise in a gynecological practice. It has become part of everyday medical care. So the question is not whether this happens. The question is why. There are many reasons behind this shift. Long educational pathways and demanding professional careers often delay family planning. Many highly qualified women spend years completing their education and establishing themselves professionally before considering pregnancy. Advances in fertility treatments have also made it possible for couples to pursue parenthood later than previous generations could. Social factors play an important role as well. Some couples postpone having children because of limited childcare support. Others face temporary employment contracts and uncertainty about financial security. For some, the lack of flexible or part-time work options makes the timing feel impossible earlier in life. Often, it is not one single reason. It is a combination of many different life circumstances. Eventually, many couples decide that now is the right time to fulfill their wish of having a child. When I look at the maternity record used during pregnancy, there are various boxes that can be checked to indicate potential risk factors. One of those boxes refers to maternal age over 35. Many women see this and immediately become anxious. Why is my age considered a risk factor? That is an important question. Research indicates that certain pregnancy complications, as well as some chronic maternal conditions, become more common with increasing age. Let's look at what that actually means. One example is miscarriage risk. For women between the ages of 25 and 29, the risk of miscarriage is approximately 8.9%. For women between 35 and 39 years of age, that risk rises to around 20%. For women over the age of 42, the miscarriage risk can reach approximately 50%. These numbers can sound alarming at first, but they are not meant to discourage you. They are meant to provide realistic information so that you understand why doctors pay closer attention as maternal age increases. There are other examples as well. Take ectopic pregnancy, for instance. This occurs when a pregnancy implants outside the uterus, most commonly in the fallopian tube. A 21-year-old woman has a risk of approximately 2.1% for an ectopic pregnancy. By the age of 43, that risk increases approximately 5-fold. Again, these are statistical observations gathered from large groups of women. They do not predict what will happen to any one individual. This distinction is very important. One of the challenges in medicine is explaining the difference between population risk and personal risk. Statistics help us identify patterns. They help us know when additional monitoring may be useful. But they cannot determine your individual outcome. Biology also helps explain why some risks increase over time. Many people are surprised to learn that a woman's egg cells are formed before birth. From that point onward, those cells accompany her throughout life. Even while she herself is still developing in the womb, those egg cells already exist. As the years pass, they are exposed to countless influences from the environment. Nutrition, smoking, radiation exposure, and many other factors interact with the body over decades. The body has remarkable repair mechanisms. But no biological system is completely untouched by time. Gradually, changes can occur at the cellular level. Often, these changes happen quietly and without any symptoms. The invisible processes taking place inside the body long before pregnancy can influence reproductive outcomes later in life. One example involves chromosomal abnormalities. As maternal age increases, the likelihood of chromosomal changes in the egg cells also increases. As a result, the chance of chromosomal abnormalities in the baby becomes higher as well. Understanding this process is not about assigning blame. It is not about creating fear. It is simply part of understanding how the human body changes throughout life. And understanding these changes allows us to provide more individualized care and better support during pregnancy. As we continue looking at how age can influence pregnancy, it is important to remember something that I emphasize often in my practice. Numbers tell us part of the story, but they never tell the whole story. Medicine uses statistics because they help us recognize patterns. They allow us to identify situations where closer observation may be helpful. But a statistic is not a prediction of your personal future. This is one of the most reassuring conversations I have with women over 35. Yes, certain risks increase with age. That is supported by research and reflected in clinical guidelines. But your overall health, your lifestyle, and your medical history matter tremendously. Let's take another example. Gestational diabetes, which is diabetes that develops during pregnancy, becomes more common as maternal age increases. A woman who is 30 years old has a risk of approximately 8.7% of developing gestational diabetes. For a woman who is 40 years old, that risk rises to nearly 20%. These figures help explain why doctors may recommend specific screenings and why they pay close attention to blood sugar regulation during pregnancy. I could continue listing additional statistics, but my goal is not to overwhelm or discourage you. Instead, I want to help you understand the bigger picture. If we summarize what we have discussed so far, the statement that pregnancy after the age of 35 carries certain increased risks is based on evidence. There are indeed some complications that become more common with advancing maternal age. That is why terms such as advanced maternal age or references to risk factors appear in medical records. However, there is an important but that deserves equal attention. Not all women over 35 are the same. In fact, this is one of the most important lessons clinical experience teaches us. Imagine two women who are both 40 years old sitting in my consultation room. The first woman is energetic and healthy. She eats a balanced diet. She exercises regularly. She maintains a healthy body weight. She does not smoke. She stays active in daily life and has no significant medical conditions. The second woman is also 40 years old. However, she may be carrying excess weight. She may have smoked in the past. She may drink alcohol regularly. Physical activity may not be a routine part of her life. She may already have high blood pressure, diabetes, or other chronic conditions before becoming pregnant. Chronologically, both women are exactly the same age. Biologically, however, their health profiles are very different, and those differences matter. The risks associated with pregnancy may be considerably higher for the woman who enters pregnancy with existing medical conditions compared with the woman who begins pregnancy in excellent health. This is why individualized care is so important. Medicine cannot simply look at your date of birth and determine exactly what your pregnancy journey will look like. Research indicates that overall health status strongly influences pregnancy outcomes. As one factor, body weight is another. Blood pressure matters, pre-existing diabetes matters, lifestyle habits matter, physical activity matters, nutrition matters. Each factor contributes to the larger picture. So if you are 36 or 37 years old and your doctor checks the box indicating maternal age over 35, it does not automatically mean that you will be classified as having a high-risk pregnancy. Many women are surprised to hear this. There is not always a rigid rule that says one factor alone defines the entire pregnancy. A single checkbox does not necessarily determine the overall assessment. Thankfully, obstetric care is much more nuanced than that. Every woman is evaluated individually. Her medical history is considered. Her current health status is considered. Any previous pregnancies are reviewed. Existing conditions are taken into account. The complete picture matters far more than one number on a chart. This individualized approach is one of the reasons modern prenatal care can be so effective. It allows healthcare providers to adapt care to each person's specific needs rather than treating everyone exactly the same. The body itself also reflects this complexity. Many changes associated with aging occur gradually and silently. Long before symptoms appear, Tissues adapt and respond to years of life experiences. Blood vessels may change over time. The body's ability to regulate glucose may shift. Hormonal responses may evolve. Cells continue carrying out countless repair processes every day. Most of these changes happen quietly. You cannot feel them. You cannot necessarily see them, yet they help explain why healthcare professionals sometimes recommend more attentive monitoring as age increases. This is not meant to label the body as fragile. Quite the opposite. The human body is remarkably resilient. It adapts continuously. It compensates. It works tirelessly to support both mother and baby. But understanding where extra support may be needed allows us to intervene early when necessary. Many practical details about this process are not discussed fully during routine appointments, simply because clinic visits are often short and there is so much information to cover. That is why I believe education matters. When women understand why recommendations are made, they often feel less frightened and more empowered. Instead of hearing, "You are over 35, so you should worry," they begin to understand the real message. The message is this: because certain risks become somewhat more common with age, we pay closer attention. We monitor thoughtfully. We individualize care. We support you where support is needed. And in many cases, pregnancy progresses beautifully. One of the most encouraging things I have witnessed throughout my years of practice is seeing women who initially arrived filled with fear gradually regain confidence once they understood these nuances. They realized that age alone did not define them. Their health habits mattered, their resilience mattered, their medical team mattered, and their pregnancy story was still uniquely their own. This balanced perspective is essential. Acknowledging increased risks does not mean assuming negative outcomes. Recognizing areas that deserve attention does not mean expecting complications. It simply means practicing informed, compassionate medicine. And that distinction can make all the difference in how a woman experiences pregnancy after 35. Now, let's talk about what all of this actually means in day-to-day medical practice. After hearing about increased risks, additional screenings, and statistics, many women ask me a very practical question. "Doctor, what will be different for me?" The answer depends very much on the individual sitting in front of me. Let's return to the example of the two women who are both 40 years old. One is in excellent health, physically active, maintaining a healthy weight, and entering pregnancy without significant medical conditions. The other has several factors that may increase her chances of complications, such as high blood pressure, diabetes, previous smoking, limited physical activity, or other underlying health concerns. Even though they share the same age, their prenatal care may not look exactly the same. This is where individualized medicine becomes so valuable. In some situations, prenatal care may become a little more intensive. That simply means I may want to see a patient somewhat more frequently than I would see a healthy 20-year-old woman or even another healthy 40-year-old woman. These visits are not designed to create anxiety. They are opportunities to monitor the health of both mother and baby more closely. Sometimes that may include additional ultrasound examinations. Ultrasound allows us to observe growth and development, assess certain structures, and identify concerns early if they arise. In some cases, I may also pay closer attention to the cervix. Research indicates that cervical shortening becomes more common with increasing maternal age. Because of this, I may occasionally recommend evaluating the cervix more frequently during pregnancy. Again, this is not because complications are expected. It is because early observation allows us to respond appropriately if changes occur. This is one of the central principles of prenatal care. We do not wait for problems to become severe before taking notice. We monitor thoughtfully so that we can support the healthiest possible outcome. You may also hear discussions about specialized prenatal examinations. Depending on the qualifications and experience of your gynecologist, you may be referred to a specialist for additional prenatal diagnostics or a detailed prenatal ultrasound examination. Many women become concerned when they hear the word specialist. They assume something must be wrong. In reality, that is often not the case. Sometimes it simply reflects an additional layer of reassurance. A second set of experienced eyes can provide valuable confirmation that everything appears normal. This four eyes principle is something many healthcare professionals appreciate. It allows important findings to be reviewed carefully and thoroughly. Another topic that commonly arises is non-invasive prenatal testing, often referred to as NIPT. Since we have already discussed that the likelihood of chromosomal abnormalities increases with maternal age, This is an option that should certainly be discussed with couples when the mother is over 35. The purpose of these conversations is not to pressure anyone into making a particular decision. Rather, the goal is to ensure that parents understand the options available to them. Informed decisions are always better than decisions made through fear or lack of information. And now, after spending so much time talking about risks, statistics, monitoring, and medical considerations, I want to shift our attention to something equally important. There are genuine advantages to becoming pregnant later in life. I think this part of the conversation deserves much more attention than it often receives. Most women over 35 are entering motherhood from a very different place than they were at 20. Take a moment to think back to who you were at that age. Many of my patients laugh when they reflect on it. They remember how uncertain they felt, how much they were still discovering themselves, how different their priorities were. I often think the same thing about my younger self. As the years pass, many of us become more grounded. We know ourselves better. We understand our values more clearly. We often feel more emotionally stable and more confident in our decisions. This emotional maturity can be a tremendous strength during pregnancy and parenthood. There are practical advantages as well. Many women have had years to establish financial stability. They may have developed careers, built savings, or created a home environment that feels secure. Access resources can ease some of the stress that naturally accompanies raising a child. Relationships, too, are often different. Partnerships may be stronger and more stable than they were in early adulthood. Communication skills may be better developed. Conflict resolution may be healthier. Shared goals may be clearer. Of course, every relationship is unique, but many couples report feeling more prepared for the responsibilities of parenthood later in life. This perspective is important because pregnancy after 35 is often discussed almost exclusively through the lens of risk. Yet life experience brings strengths that should not be overlooked. You may be more patient, more confident, more resilient, more certain of the family you wish to build. So if you are over 35 and thinking about pregnancy, or if you are already expecting a baby, I want you to remember this. Yes, there are certain risks that increase with maternal age. Clinical studies show this clearly. That information should not be ignored, but neither should it be exaggerated. Age is one piece of a much larger picture. Your overall health matters. Your lifestyle matters. Your medical history matters. The care you receive matters. And most importantly, you are an individual, not a statistic. In my years of practice, I have cared for countless women over 35 who have gone on to experience healthy pregnancies and welcome healthy babies into their families. The purpose of understanding risk is not to create fear. It is to guide thoughtful care. It allows us to monitor appropriately, recognize concerns early, and provide support where it is needed most. Knowledge should empower you, not frighten you. So if you find yourself carrying that label of being over 35, I hope you no longer hear it as a warning that something bad will inevitably happen. Instead, hear it as an invitation to be informed, to work closely with your healthcare team, and to approach pregnancy with realistic expectations, confidence, and hope. Every pregnancy is unique. Every woman brings her own story, strengths, and circumstances into motherhood. And that is exactly why personalized, compassionate care remains at the heart of good medicine. If this video has been useful to you, please give it a like, subscribe to the channel, and turn on the notification bell. Help me reach 50 zeros in subscribers so that more people can receive this information.